that for me or because it's the last speaker dying? Both. So the final presentation is going to do a comparison for you between the AOAC method validation through our guidelines through AOAC versus the ISO 16140 Part 2 that I had mentioned. But we'll start first with looking at, on one side of the screen, you'll see these are the certification bodies that are recognized globally to do method validation. So the three I mentioned earlier in Europe, and then the one AOAC based in the US. And generally, the reference methods that are used for comparison will be then ISO SEN methods for the 16140, and AOAC methods can be used as a reference method, as well as our government's reference methods, FDA BAM, which is used internationally, and the USDA Microbiological Lab Guidebook. So usually, as we spoke earlier, reference methods are culture methods, and they vary a lot by country. Some are very similar. For example, salmonella methods are quite similar between countries, but differences in time and temperature and just slight variations. You know, this is right in the way of looking at my own slides, so I'm going to just adjust it. They can be ISO methods, and because ISO methods are recognized internationally and they are standards, many countries just adopt them as their reference method. And some are harmonized with AOAC and ISO, as you've been shown earlier, chemistry methods, not micro methods. And some are legislated. As I showed you before, the European Union has a specific regulation that might be later in these slides. I can't remember my slide deck now. But here's what I know about micromethods and where they're regulated today. The countries in red actually say that you must use these methods for doing microbiology testing. I don't know so much in Africa. I know a little bit of what was gathered and will be talked about in a session on Wednesday. Is that right? Tomorrow or Wednesday. Okay, tomorrow. And then these are microbiology methods that in green the country allows for other methods. So the US, for example, they have their own methods, but they also allow the use of other methods if they've been shown fit for purpose to meet the US regulations. And the same thing in Latin America. I'll show you some lists that really say you can use a variety. And as we talked about with the ISO method validation, you can use alternative methods other than the reference method. Now, Canada, you can use alternative methods, but you have to follow their procedure for method validation. So it's limited to what they will accept, only their kinds of validations. China uses the GB standard, and that's it for now for official method testing, as does Korea has their own official methods, and Japan. India uses ISO methods exclusively for microbiology testing today, but they're starting to look closer at 16140 and determining if they will be accepting the use of other methods. So here's a really detailed part of that European Directive 2073. So it's telling you in these particular foods for looking for Listeria monocytogenes, this is the method you must use. But, as I showed you earlier in Article 5, it says if you compare to this method, following these guidelines, you can use other alternative methods. In the US, in our Code of Federal Regulations, it says that where a method of analysis is not prescribed in a regulation, you can use an AOAC official method of analysis. Now, they haven't caught up on the terminology what AOAC means, because they're saying it's official analytical chemists, which we are not that, but this is up to date. It's just that FDA is not up to date. So here it's within USDA and FDA, they have certain guidances. And in this session tomorrow, the slides that were put together, I included the references so that you'll have them when you receive the slides, so you can access these references and look at these specific details. But they're calling out that they allow the use of other methods. But the methods they allow are ones that are validated through other certification bodies, recognized bodies. And then different countries also allow for different methods. I'm just showing you examples cut and pasted from their sections of their requirements for methods. I don't need to read it to you, it's just detailed, but just to show you that they are official. Now, ISO methods and AOAC official methods, you have to pay for them. They're copyrighted. And for that reason, the US cannot enforce that you must use an ISO method or an AOAC method, because by law, they can't force a user to pay for the method. And that is why the FDA BAM and the USDA MLG are available freely online. These are the methods that are used in USDA and FDA laboratories. They may use others, but these are the preferred methods, and that's why they're listed there. Health Canada, as I mentioned earlier, they are available online, but you need to click on them, receive the email, and say, please send me this method. I think they do that so you have the most up-to-date method. Because if you're being accredited and they look at your records, you have to have the most current method. So India, it's interesting. I'm not quite sure how they do this. I keep asking, but I haven't been able to figure it out. They take the ISO method, and they review the ISO method. They might make a slight change to it, and they call it a Bureau of Indian Standard method, and assign it a new number, and then they make it available for cheap in India, because the labs in India couldn't afford an ISO method, so that this is, I don't know if they pay a license fee to ISO to do this, but I know this is what they do, and that's their reference method. So here are the certification bodies. The three we talked about earlier, NORDVAL, MicroVal, and AFNOR. And we can't say an AFNOR validation anymore. We have to use, this is the specific terminology that we use, NF validation via AFNOR certification. It's a mouthful, but that's the correct way. All follow 16140 as their validation guideline, and AOAC has its own research guideline, or guideline for validation. So a little bit more about MicroVal. It's specifically focused on microbiology methods, but they're starting to look at other things. We've had requests for water, viruses, and a few other things, so that could be expanded in the future. As I said, it's based in the Netherlands and run by their ISO body, NEN, National Standards Institute. They prefer that ISO be the reference, but they are open to other reference methods being used to do the method comparison, and they can validate methods besides the ones following 16140. So far, they have over 30 methods that they've reviewed. Erin is on the technical committee. You'll meet Erin tomorrow, and she can tell you more about what she does. So the NF validation through AFNOR, they have been around the longest of all the certification bodies, including the AOAC certification body. They do both microbiological and chemical. They are the ISO member for France. They also do certification of other things, so they do audit laboratories, manufacturing sites, and give a certification. They only allow the use of ISO as the reference method, but you can see over 130 micromethods since they started in 1989. NORDVAL, as I mentioned, they do food and feed, both chemical, and they do microbiology and a little chemical. Based in Denmark, used to be based in Norway. It's moved a little bit. It's administered through the Nordic Committee on Food Analysis, NMKL. And as I said, mainly for the Nordic countries, they have over 23 methods that have been certified. And last is the AOAC Research Institute. They do microbiological, chemical, allergen, water, a wide variety of things, and are able to do more. Based in Washington, you can use any method as the reference. So my company, 3M, has used ISO as the reference to get a validation for Enterobacteriaceae, for example, because there was no FDA method for Enterobacteriaceae, so we used an ISO method to get the AOAC validation. You can get an AOAC performance-tested method, an AOAC official method of analysis, an AOAC performance-tested method, and then an AOAC official method of analysis. And you can also, I wonder if I have another slide on this, or if I should describe it all right now. I think I will, just in case. Let's see, how long ago was it? Maybe 25 years ago that the Research Institute started? Oh, 1991. And this was done because it was taking so long to get official method of analysis validations, and people wanted some kind of a certification on the method so they could use it. And so this structure was put in place, and people started doing these method comparisons. And it's the same as you do for an official method of analysis. But for the official method of analysis, you continue on and do a collaborative study. And so once you finish your method comparison, you can get the PTM, for performance tested method. You've proved that your method meets the performance requirements you state in your package insert. If you want an official method, and if you want your method used by government agencies, you should want to continue on to get an official method of analysis. And so that would include the collaborative study. And because we had done that harmonization project with ISO and AOAC, and come to some agreement on some of the criteria, we now decided there's a way that we could do a harmonized study. The ideal would be have one protocol that you do to meet the criteria of both AOAC and microvalve, and then AOAC and microvalve themselves would have some, maybe a little additional criteria, but the main comparison study would be done as one. And so there haven't been too many done that way yet, but it's catching on a little bit more. Now, AOAC has done a lot more for certificates, 200, well, it's probably close to 300 now, but that's microbiology and chemistry. Mainly microbiology, though. I'd say 80%, I think, are microbiology. But for any of these certification bodies, there are three things that are required. The validation study, a check of the quality system of the manufacturer making this non-proprietary method, to ensure that that method, you can expect the method to give the same result every time it's made. And then a renewal of the certified method to prove that there's no change to the method, it's still performing as it did when it was certified. So I'll go through each of these parts. So as I was telling you, for validation, you can stop. I was going to point at this one with my pointer, man. Okay, so if you do a performance tested method, you can do a lot of that study internally, but you have to do 20% of it at an independent lab. So repeat 20%, I should say. So if I was doing 10 different matrices that I was validating, I would have to repeat 2 of them at an outside lab to show that it's not just me that can get these results correctly. An outside lab is saying, yes, it was done independently and it can be done. And you can stop there and get a certificate for a performance tested method. And then if you want, you can continue on, oops, push the wrong button, to get a collaborative study. For an ISO method comparison, you have no choice. You have to do the collaborative study. It's part of the law. A regulatory agency will want the collaborative study done, so you must do both. Here are those 15 food categories I was mentioning, as well as 3 additional categories: food and animal feed, environmental testing, and primary production samples. And these are agreed upon between AOAC and ISO as part of that ISPAN project that we had. I'm just showing, this is AOAC's, the way they're explaining it, to make your claims. You're doing 15, from the food matrices, you have to do 5 of the categories to make that broad range of food. These are listed again in the references that you'll hear tomorrow in those slides. So, I tried to explain a little bit. If you test 5 categories of food, you are asked to do at least 3 different food types, the types of food within the categories, and then 20 different samples from each of those food types. So you're testing at least 60 different kinds of food types from that food category. And this might help make it a little easier. So if you're looking at meat products, here are 3 different types of meat, and then within each of those types, 20 different kinds of samples. So you're getting a wide variety when you're making the claim that my method works for meat, because I've tested a lot of meat. So the things that are very similar between the two are inclusivity and exclusivity. So does it detect what you want it to detect, and does it not detect the things it should not detect? And then one kind of main difference between the two is that the ISO version always wanted you to do natural contamination. And it's hard to find naturally contaminated samples in the US. Not that our food is so wonderful, but it is kind of bland and sterile. It's not exciting like some foods here. So we have to inoculate our foods. But now with the new updated 16140 document, there is a way that you can inoculate foods as well, and they follow what AOAC has done to stress the organism and then equilibrate it in the matrix before you do the testing to make it seem more realistic. And as I mentioned, if you do the testing in-house, you still have to look at 20% of the foods have to be retested outside in an independent lab. One thing that AOAC does, and it's not part of the 16140, is to do this group of tests. So they want to look for robustness of the method. They want to look as how stable is it and how rugged is it. If you are supposed to, on a petri film plate, if you're supposed to inoculate 1 mil, what happens if you only get 0.9 mils? Or what happens if you get 1.1 mils? Is the result still statistically valid? And so we have to challenge different factors that we think could happen normally in a lab to ensure that the method is robust enough to get the same answer as expected. Stability is looking at, if we have an expiration date of 2 years, we need to test product that's just made, a test kit, a product that's at the end of its shelf life, and then a product in the middle of the shelf life to show that, yes, I'll get that same result regardless, and the 2-year expiration date is correct because the method works the same. And then lot to lot, so each time it's manufactured, is the manufacturing process robust enough that you can expect that you get the same method made the same way. So we have to test different lots of the product and of instruments, if instrument is part of the method. And then for the method comparison, things are really pretty much the same now. Just one matrix needs to be tested at 3 different levels. The samples are sent blindly, so when they test it, they don't know if they're testing high, mid, or low level at that point. The only difference could be that for the USDA, sometimes they require a large sample size. ISO methods are generally 25-gram sample. The USDA has a 375-gram sample. So if we have an odd sample size, we may have to do 2 samples in our collaborative study for the AOAC. And for qualitative methods, you need at least 10 data points, or data sets, and 8 if it's quantitative. And so that's why I was mentioning we usually invite 15 labs to participate, because we know someone might receive a sample that is not the right temperature upon arrival, so it can't be used. They might have a spill, there might be some other error. So if we end up with all of them working, we just have 15 data sets to submit, but it's just kind of, in case there are issues, we still end up with 10 and don't have to repeat the whole thing all over again. So I mentioned the harmonization between the official method of analysis for AOAC, and Microval and AFNOR. I don't know that anything has been set up yet with Nordval, but there have been studies done with both Microval, and one has been done so far with AFNOR as well. Something that's helpful is that they have common reviewers now. So the chair of the AFNOR technical committee is an expert reviewer for AOAC, and he's also a reviewer for them on the Microval technical committee. One of the co-chairs of the expert review panel for AOAC is also a member on the Microval technical committee. 2 of the FDA expert reviewers on the AOAC committee are also on the Microval expert review committee. So we're starting to get some interaction, and it will help for these types of studies, so we're looking at things the same and having discussions together. Alright, so that is part 1 on validation. Part 2 is looking at the quality system, and it's quite different between the 2 protocols. So for AOAC and for Nordval, they look at the package insert to see what you're claiming. They want to look at the user manual and any instructions just to see what are you claiming the product does and how you're labeling the product. And even labeling with the AOAC mark, so you're not claiming more and putting the AOAC mark on there when you really don't have data to support a claim. And then there's the AOAC requires to look at a schematic. So this is just a made-up schematic, but they want to see where you're doing quality testing throughout the process to prove that your process is in control throughout the process. And in addition, remember the other things I mentioned, robustness and stability, are also helping to look at your manufacturing process is in place, you're getting the results the same every time, so the method you can expect to get the right result from the method. For Microval and AFNOR, they both do audits. So if there's no quality management system in place, then they both do a full audit of the facility, physical audit at the site. If you are certified to ISO 9001, Microval does a limited audit and AFNOR does the audit. AFNOR is a certifying body, so they have auditors on site that can do this work. But Microval has to pay an auditor to do it. They're not a certifying body. And if your quality management system is under ISO 13485, which is for medical devices and quite high level quality management system, then Microval says no, we don't need to do it, but AFNOR can do it, so they do it. And they will come every, what is it now? 4 years, I think it is. Every 4 years, they come to your facility and go to every single one of your facilities. So every 4 years, we have an auditor on site for 2 or 3 days in each of our manufacturing sites to review our quality system and see that we're following it correctly, and would mark us up if we did something wrong. We'd have to correct it. So the last thing is renewal, and these are different between the two different protocols as well. So for ISO 16140, if you want to renew Microval or AFNOR, if you do not have a quality management system in place, then they will come and audit every 2 years versus every 4 years. And if you do have the other two, then it's every 4 years. And then every 4 years, if there's been no change to anything, you still have to do a small study, a verification study, to verify your validated method is still performing as it did when you received your certification. But if there's been a change in your method, then you should have submitted a method modification and gone through a review process. If there's a change to the reference method, when your time comes up for renewal, you will have to do a larger study to prove that the change that was made to the reference method does not affect, that you still are equivalent to that reference method. And because 16140 Part 2 was updated in 2016, every one of our methods that is coming up now on the 4 years has to be compared again to this new updated 16140 Part 2 to show that we are still meeting the standard. For AOAC, the PTM certificate is granted for 1 year, and then you sign a legal document each year to state that we have made no changes to this method. And if you have made a change, you should have. You don't wait for the year. You have to report to AOAC, we've made a change, and you're going to have to revalidate or do some level of revalidation of the method to prove that it still compares well to the reference method, and go through the certification process again. For an official method of analysis, there is no review required, but as I mentioned, there is a process in place to do a first action, and then 2 years later, a final action to show that it's working well in the market. And I just put this up because a lot of people talk about PTMs and they think that's all they need to do, and maybe that's all you do need to do. But government agencies really prefer a fully validated method, and fully validated means a collaboratively studied method. So it's required by the 16140 document, it's required in the EU directive, it's required in the FDA BAM, as mentioned in the Code of Federal Regulations. They said official method of analysis, they didn't say PTM method. And then many other agencies around the globe, the way they validate, they do a collaboratively studied method. So that's what they look for, an interlaboratory study. And I just put this up. My only advertisement is because 3M has been around a long time in this. We were the first AOAC official methods with our Futureville methods, the first AFNOR certified method. We aren't the first harmonized method with Microval. I think we're a little behind on that one, but we were the first one with AFNOR. And that is all I have for this. If you have questions, I might as well just stay up there instead of go, right?
And it's already open the floor to any questions.
Given the unique matrices on the continent, I think you heard some of the products that we have, like cassava, etc., that we are producing. The decision to go the AOAC, route or the ISO route. Yeah. I mean, how does one actually go by deciding which route they're going to go with in terms of costs? Because one of the issues that we've seen on the continent, we do have a number of challenges relating to availability of things like certified reference materials, and there's an opportunity for some organizations to be able to actually produce these, especially given that we need them for proficiency testing, for interlab, etc. So I'm just thinking around making this really practical for the African situation, and deciding on which methods to go with, either to go for the PTM method or the OMA method. How does one go by, deciding on that?
The PTM or OMA, or you mean the AOAC versus
the AOAC versus the ISO method. Yeah.
So I heard a couple questions in there, actually. The first was, am I already forgetting it? I'll do the first one I can remember. And that was the different matrices. That has been, I think, the biggest thing. When we created those 15 categories, I have to say it was mainly North America and Europe. We had a few from Asia and a few from Latin America, but they don't speak up as much when there's so many other groups in the room. And so all the interesting foods are in other parts of the globe, and we need to think of ways to do a matrix extension that could include some of those foods. We have a good example from the India section in vitamin B12 that they worked on that because they had differences in the matrices that was used in the official method of analysis that didn't work for their particular matrix, and so they came up with a new protocol and have submitted it as an extension. So that's one way to address getting new foods in now, but when we update the 16140 part 2, we need to expand possibly the food groups and take a different look, because Japan does a lot of fermented foods. That's not on the list. So there are many things like that. Reference methods, that was another question that you mentioned. So, not the reference material. And that would be, I would guess, the organisms, what you're thinking about. And that is the same as required for both. So that wouldn't help you decide which one. It needs to be a traceable one. Some ISO prefers it from the foods that you expect them to be from, that they should be isolated from those types of foods. But AOAC would like that as well. It's just more of a requirement in ISO. But it's the same for both, so that wouldn't help you decide. So the decision would probably come from what is your requirement for export, and that would help make your decision which would be the most beneficial for you to do. I don't know. Erin, do you have a better answer for any of those? You might. She's the one that's just right there. Could you bring the microphone to Erin? Oh, thanks.
Is this on? Yeah. Yeah, I just wanted to add, as far as the organism goes, definitely what we call reference material on the microbiological side is looking at the organisms that come from a traceable culture collection, and that is more predominantly used within the AOAC community, whereas ISO does require more what we call wild-type strains. And this is particularly compelling when we are looking beyond the European Union and the US, because the wild-type strains that you have here in your own collections would be a wonderful addition to not only the commodities that you would extend in the matrix extension, but looking at the organisms that have been implicated in those particular products. And then as far as the reference method goes, there's a lot of momentum that we've gained in the harmonization efforts. And one way that does help to solve the problem of which reference method, even though it may be an additional cost up front, is we recommend doing what we call a three-way comparison, where you have the ISO reference method, additional either local reference method, oftentimes in the US it's the FDA or USDA method, and then the proprietary method.
That's a big long question. It was a good one.
Thank you, Dan, for the presentation.
Yeah.
It's quite enlightening. My question is on the use of ISO methods. You said you have to pay to use them.
You have to pay to purchase the method itself.
To purchase the
yeah.
method. What about if the method, like for academic purposes, is referenced in an article? What do?
You pay for them.
So you can't use the method. You have to buy it.
To access the method, you have to pay.
Access the method.
Yeah.
Okay. Yeah, because I had a student who had that problem. You know, in vitro, especially digestibility,
yeah,
there are various methods, but this one that she wanted was ISO.
Yeah.
You know,
I'm sorry.
Okay. It's the same with AOC, you have to pay as well.
Yeah, for the official method you do.
Okay.
Yeah.
If you're a member, though.
Yeah, that's true. If you're a member, you have access to the method. Yeah. So, yeah. But that would be the university. But if you're a member, then you have access to any AOAC method.
So you can't.
It would be cheaper to be a member and then get access to all versus one.
So basically, what you're saying is that you can't. Let's say you write an article, you can't reference to an AOAC method but purchase it.
Yeah, because you're not sure what you're referencing it to.
All right, thank you.
Sorry. Yeah.
Thank you. My name is So Sringwani from Zimbabwe. Further to Dr. Gazipa's contribution and your response that maybe where you are exporting is what's going to guide your decision-making process.
Yeah.
This morning, and we are all aware that inter-Africa trade is a big challenge, and it's not there. It's of concern that we're not trading among ourselves. I think it's also an opportunity to question, to say, is this not also a barrier to inter-Africa trade? To say, is Africa, given the limited financial resources we have, is there a way that we can also remove a barrier to trade by ensuring that the methods that we have as Africa to boost our own trade we're able to sustain them? Thank you.
So, for the methods in Africa, though, are you thinking your own country methods, or are you thinking AOAC or ISO methods?
This is really a broad question. Whether ISO or AOAC or involvement of academia, it's really a broad contribution. But the aim is that inter-Africa trade needs to be boosted, needs to be enhanced.
Yeah.
Yes, and whatever intervention that will assist there, I think it will assist trade, facilitate trade. Thank you.
Yeah, and it's not just Africa, it would be similarly in parts of Asia and Latin America too. That's concerned. A question from a chemist? I'm just going to make this answer up.
Sorry, no, I will not have the question. Maybe just an addition related to the ISO methods, because they have to be purchased, but they can be purchased at the national standardization body. And a way how, I'm from Nestlé, so you can imagine that we have multiple labs using ISO standards, and you can discuss with your national standardization body to have a license agreement so that you can buy it once, but you can share it with multiple labs in your country or organization or whatever. So my advice would be a discussion with your national standardization body if you want to access ISO standards.
Mm-hmm. So there's one question here and then over there.
Hi, my name is Wandu with Helica Biosystems in California. I just want to address a couple of issues. I'll just limit my discussion to those. This is specifically regarding commodities and foods of African origin, as has been mentioned before by various people. Our company is a small company that makes kits for microplastics, so that would be under the category of chemical residues. We rely very heavily on ISO 13485 for maintaining our quality systems, and as you mentioned, it's basically for medical devices, but it's very, very strict.
Yeah.
Okay. And the reason I bring this up is we spend a lot of time validating a lot of foods. For example, we validated many kinds of spices from India, a variety of foods from Ethiopia, specific foods, blends, things of that sort. We do a lot of matrix-specific studies, and we have documented this in our own manual that we keep in our lab, and a number of our package inserts have specific protocols for specific foods and commodities, extraction protocols. You want to deal with different matrices, you cannot use one extraction protocol. There's no such thing as one size fits all. And this is how we do things. And then we provide kits to academics and other NGOs to work with our kits and publish. And many of them have published. And if you come to our stand in the back, we have a list of publications that, places like ILRI and a variety of universities worldwide have validated our kits. Now, I say this because when we started out, we looked at AOAC, and I've been a member of AOAC for many years. And we determined that the cost of validating kits, even for ATM, is prohibitively expensive for small companies. I think only 3M Waters can afford $100,000 per kit. We have over 20 kits, and most of the kits can be used for a variety of commodities. My information, I'm bringing this up because this is the first time it's being done in Africa, so I want to show it from the other end, from the manufacturer's end. And I appreciate everything that you presented, but we need to put dollar figures on it. Just to start out, it costs about $35,000 to validate a kit, US dollars. Okay, and you keep adding different commodities to validate. It can go up to over 100,000 US dollars. Companies like ours cannot afford that. And we've had this discussion within AOAC Mycotoxin Community Group before. So this is nothing new. But we have adapted to using our own self-policing standards under the ISO 13485 guidelines, and basically validate our kits starting with international standards, certified reference materials, our own internal validations using spike recovery studies, which we do almost on a daily basis, and then maintaining the quality with day-to-day, lot-to-lot reproducibility of our assays. And to give you an example, we keep Levy-Jennings charts on every lot that we make, and just recently we analyzed like 5 years worth of data on a couple of kits. And I can tell you, nothing was more than 13% coefficient of variation. 5 years lot-to-lot consistency. The reason I bring it up is if you follow quality management protocol, you can nail the reproducibility of the assays. Okay, day to day, year to year. Another thing, we're always innovating. We're always tweaking our assays. And we make sure that this is also recorded. And my discussion with the local AOAC in Southern California is that as long as we keep a record of our validation and our quality control data, okay, AOAC certification is not even necessary, because it's voluntary. Okay, I'm speaking for basically our area, for mycotoxins. Microbiology is a lot more complex. I know it because I started out in microbiology. Okay? It's a lot more complex, and you've explained very well, and that's appreciated. But for the audience here, I just wanted to just bring this up. As a manufacturer, what challenges that we face, and the way we handle it. We work very, very closely with our customers. Could be government agencies, for example, Kenya Bureau of Standards, we work very closely with them. Dairy companies in China and other areas, spice companies. We work very closely with all these organizations, and we actually customize procedures for them. Because if they buy, I hate to say this, an AOAC approved procedure for Western type foods and commodities. It doesn't work in India. We have to modify our assay so it would work with chili samples, specifically in India, because they're working under extreme humidity and temperature conditions. We develop the kits in controlled environments. You take it out to the field, it's a different story. So we have to make some tweaking, and we make it work, and they accept our assays, and they repeat our validation. A lot of the laboratories are HPLC instruments. Our kits, most of our kits have been validated against HPLC instruments, and you know, we have all the different parameters that are studied. You know, all
Yeah,
recorded.
I think it's smart what you've done
Yeah.
to do this.
And
Just make sure that when you made those tweaks,
yes.
I mean, you have to eliminate the other data that you had now because it's invalid because you've made your tweak. So you have to be, yeah.
We don't throw it away because it may be useful for another country.
But you've made a change to your kit,
Yes,
so
we
it doesn't
have.
count anymore.
Right, but there are regional differences. That's the point I'm trying to make. You see, and then when it comes to the foodstuffs, I mean, some of the spice blends in different parts of the world, they're not easy. But we take the challenge, and it's difficult. When we can't do it, if we don't achieve at least 75% spike recovery, we don't put it in the market.
Well, thank you. I appreciate all that.
And our records are subject to visits and inspection, and a lot of our big customers, they come and inspect our lab, they look at our data. So I just want to share this with everybody.
Thank you very much. Another question here?
Yeah, thank you. Thanks, Deanne. I had two. One's a comment, one's a question. So I'll deal with the comment first of all.
Right.
As being quite involved in the ISO process myself, I would like to just point out that you know, this question of adopting standards is a technique that can be used in economies that have an ISO member to possibly reduce the cost, the final cost to the consumer, or in other words, to, in this case, interested parties. So that's something that maybe it follows on the comment that was made earlier. So I mean, it's not the only thing that they're looking for when adopting a standard, but if sufficient economic justification can be made for the adoption of a standard, then you know, the local body is in a position perhaps to look at the reduction of costs.
Like India did.
Well, yeah, like India did, and certainly I'm going to talk about 17025 tomorrow, and certainly in adopting 17025 it will lower the cost to the South African interested community. Okay. So that was my comment.
Oh, okay.
The question that I had for you is of a different nature, and I guess it follows on this question of accreditation, and that is in your method validation process, which looks like more like a certification process than an accreditation process, but is sort of a mix between the two from what I can understand.
You're certified, the method is certified and you become, you go through accreditation.
Yeah, so my question was, do you have any recommendations or stipulations with regard to the laboratories you use for your collaborative study, performance, whatever you want to call it? Because, I mean, do they have to be accredited? Do they have to be in some way validated for their performance before you allow them to participate? Or is it, I don't want to say this...
To participate in the collaborative study?
Yeah, so in other words, I mean, the quality of their performance surely is also in question. So, you know, how do you go about doing, you know, in both cases, ISO or AOAC for that matter?
Yeah, it's... Tell me, Aaron, if this is wrong, but I don't think there's a requirement that you have to use accredited labs for the collaborative study. We do prefer those. We look for accredited labs to be part of that study, and that they be accredited for the reference method that we'll be comparing the method to, because that is the stipulation, which makes it hard for some methods to find collaborators. They have to know how to use the traditional method, reference method, and be able to do it proficiently.
Thank you.
To be ISO accredited laboratory, to be an independent lab with AOAC, PTM or OMA. You only have to be an ISO accredited laboratory when you are an expert laboratory conducting the study through the Microval, AFNOR, or NORVAL certification bodies. But the participating labs do not have to be ISO accredited.
But the certification bodies vet the labs that they allow to do that work, so they have some kind of criteria that they are vetted on.
Correct.
Yeah.
But AOAC does not currently have a formal vetting process.
Any more questions? Well, thank you all for the good questions and the good comments. Appreciate it.
Would you all please kindly join me in giving a pictorial thank you to Diane and to all the speakers that we've had today. This concludes our speaker session for this afternoon.